How can I minimize the appearance of facelift scars?
A surgical facelift is a highly effective way to lift sagging cheeks and jowls to create a more youthful appearance. One of the most common concerns expressed during a consultation when I discuss facelift as part of a facial rejuvenation plan is the potential visibility of the facelift scar, which is located at the sides by the ears. My approach to cosmetic procedures, whether it's facelift, eyelid rejuvenation, and non-surgical procedures such as injectables, is to retain my patient's unique facial character while achieving a naturally refreshed look. Generally speaking, the people who I care for like looking like the best and natural versions of themselves at any age. I'll share how I minimize the appearance of facelift incisions in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I perform all types of facelifts, such as short scar mini lifts, deep plane facelifts, and extensive face and neck lifts. I'm also called upon to help people who have undesirable facelift scars from other doctors. This is due in part to my having developed my own adult stem cell-based regenerative healing strategies for tissue loss, surgical incisions, and scar revision. There are several factors that affect the appearance of facelift incisions. These factors include the placement of the incision, the tension on the incision after closure, and the way the tissue heals over the next several months after surgery. I cannot stress enough some basic strategies which I employ that I believe are critical to optimal results for any surgery. For example, in my practice, I spend a lot of time with my patients in my exam room with them sitting up before surgery so I can place my markings for the incisions strategically. I examine my patient's face and neck skin and soft tissue to determine the optimal direction of elevation and to determine the potential level of tension there will be after the skin is trimmed and the sutures are placed. This is a critical part of the artistry and for me to visualize the results I expect to achieve. Since I have my own facilities, I allocate and factor in additional time to allow me to never be rushed during surgery. This is something that many of my patients understand, that by investing their resources and time in having this level of attention, they're able to get better outcomes. I've seen many patients who were operated on by high-volume, low-cost doctors who claim to be the #1 plastic surgeon wherever they are. This type of doctor rushes through surgery to make up for the money they need to make in order to charge such low prices, and they end up doing unintentionally subpar work. I've also seen poor outcomes in patients of doctors who claim to be the best and charge a lot, but end up taking on too much work and the patients don't get the quality results they otherwise could have. Once again, I decided to treat each patient so that there's no time pressure and I have my schedule managed accordingly. If you think about it like an athlete, a surgeon has a time frame of peak performance in any given day. As far as how placement of the facelift incisions affects visibility or the potential of a telltale sign of having had surgery, I factor in the skin texture, the color, and contrast with the skin at the opening of the ear and the characteristics of the sideburn. For a more extensive face and neck lift, where the incision goes around the earlobe and extends upward behind the ear and back towards the hair, I designed the placement so if a woman wants to pull her hair back, the incision will be well hidden. Skin shortage and tension at the earlobe can result in downward displacement of the earlobe, which is referred to as a pixie ear deformity. When this occurs, the earlobe appears attached and elongated as opposed to detached and freely mobile. I have helped people who've come to me with this problem by detaching and redirecting the position of the earlobe attachment. I have seen many patients who've had wide scars in front of their ears due to excess skin tension. One reason for this is simply removing too much skin and relying on the skin alone to lift the face. This is not as effective as lifting the underlying tissue called the SMAS, or superficial musculoaponeurotic system, as the foundation for the skin to be supported by. Poor artistry or execution of the skin trimming is another reason for stretching of the scar by the ear. As I stated earlier, it takes time and artistic vision to plan, as well as surgical skill and experience to achieve optimal results. I feel that my experience allows me to better predict the potential issues that can occur so I can take the appropriate steps to optimize my patient's healing. Is it possible for well-performed surgery to have issues with incision visibility related to how the skin heals afterwards? The answer is yes, it's possible. I approach this part of the healing after surgery by using advanced wound healing technology to expedite the processes that occur during wound healing. I use materials such as extracellular matrix by ACell, which has been used to regenerate a wide range of tissue in the body. For example, extracellular matrix was used to regenerate an entire fingertip, including the fingernail and even the fingerprint after a traumatic amputation injury. I often combine extracellular matrix with platelet-rich plasma, or PRP, which is derived from your own blood, as a catalyst for this process. I have successfully used this strategy with facelift incisions, which appear to be virtually invisible in as little as 1 month after surgery. Aftercare by the patient and close monitoring by myself and the staff is a very important part of the strategy to achieve optimal results. While not directly associated with facelift scars, I attribute part of the faster facelift recovery my patients experience by my performing the procedure using local anesthesia with light IV sedation instead of general anesthesia. General anesthesia requires the patient to be paralyzed, and the patient needs to be on a respirator in order to breathe. The face can be distorted by the presence of breathing tubes and other medical apparatus needed when you have general anesthesia. Since I use local anesthesia with light IV sedation, the patient is comfortable and in a twilight state of consciousness. My patient's face is in a more natural state, and I have the ability to be much more precise. My patients go home the same day as surgery without suffering the side effects of general anesthesia or needing to be in a facility for monitoring for recovery. When facelifts are performed with general anesthesia, patients generally need to stay in an overnight facility, often with drains and extensive facial bandaging. The side effects of general anesthesia can linger for about a week and even delay the progress of surgical recovery. In contrast, my patients undergoing the procedure with local anesthesia typically only require a light facial dressing and return to work in about a week. For example, many years ago, I actually performed upper and lower eyelid surgery as well as a facelift for a lady who wanted to look good for her son's wedding, which transpired 10 days later. She did very well, but I would recommend a little more time before a significant event where you are getting a significant amount of attention. While no incision can be completely invisible, a facelift incision can be virtually imperceptible with a combination of minimal tension, optimal placement, advanced healing, and proper aftercare. Your facelift results start with the judgment, experience, and expertise of your surgeon. I often perform facelift with other rejuvenating procedures, including eyelid surgery and facial filler placement. As I said earlier, I believe in taking a lot of time to plan and design each patient's surgery before they go into the operating room. In the operating room, I allocate extra time to allow me to perform my patient's procedure without any time-related pressures. Every step matters. My strategy is also flexible, and I make the adjustments as the results of the procedure I'm performing materialize. Meticulous suture placement is also critical for optimal healing, which of course takes time. My patients understand the value of investing their resources and time to have the level of care they need in order to get the natural results that they want. My patients are with me for the long term, and I continue to be their beauty doctor for injectables, laser, and skin rejuvenation for years after I perform their facelift surgery. I believe that surgeons whose practices are geared toward volume cannot provide quality because of limited time and being rushed and unable to focus. This statistically can lead to a higher rate of undesirable scars and other avoidable complications. I hope you found this information helpful. Thank you for your question.